A lot of people listening to this podcast might not even know what hyperbaric medicine is. And so I'd love to dive in deep.
So hyperbaric therapy is a combination of increased atmospheric pressure and increased inspired oxygen. And so we combine those two things together to drive a huge amount of oxygen into the circulation. Red blood cells are how we carry oxygen. And then why do we need oxygen? Of course, we need oxygen to be the final electron acceptor in our mitochondria so that we can make ATP our energy currency. So how can you increase your oxygen carrying capacity? You release a hormone called epogen, or EPO for short. If you take EPO or you go to altitude where EPO is released, you're going to get a number of increased red blood cells in circulation. Now, what we do in a hyperbaric chamber, though, is different. We increase the amount of oxygen in circulation by driving oxygen into the liquid of your bloodstream. Your red blood cells are already saturated. We can actually still get more oxygen in because we can saturate it into the liquid. And this is because we're simulating the pressure you feel under a certain amount of seawater.
Yeah. Dr. Scherr, thank you for joining me today.
Happy to be here, Darson. Thanks for having me, man.
Yeah. So, we met as part of the Longevity Doctor group, which is a group of about 300 of us that are kind of a mind meld on longevity, which I love. And
Absolutely.
Why I really wanted to have you on is you are the consultant to the longevity doctors often that we reach out to when we have questions and protocols that we need. So I was like, you're the expert's expert.
Well, with very specific topics. You guys have a lot of expertise that I do not have, let's be clear. And I also ask for advice all the time too. So
No, you're so humble, but I love it that you have done a deep dive in some therapies that we use here for longevity. That actually, I think it's so funny when we talk about longevity, right? Like all these technologies just came out to add years to our lives. In reality, we've been using these for a long time just in regular medicine.
Sure. Yeah. I mean, everything from methylene blue, which I know we'll talk about, to hyperbaric oxygen therapy, which are kind of the two areas I have an expertise in. Right. The focus on longevity is also interesting, as you and I both know, because if you have a genie and you can ask for 3 wishes, if you ask for eternal life, make sure you also ask for eternal youth, right?
Absolutely.
Because who wants to live all these other years but not have the health span associated? I know that's a big thing for you too. So
yeah, exactly. Isn't there a Greek fable about someone that asked for eternal life and he ended up becoming like a completely shriveled up old human that lived forever? I mean, how miserable does that sound?
Yeah, it is. It's a true Greek, it's a Greek fable for many, obviously from that time. But the deal still applies, right? Because now we are living longer overall, but as a result of living longer, we're not living healthier. And that's kind of our deal, right? The idea is how can we really truly optimize health span as opposed to just thinking about longevity as well?
And that's my primary goal, right?
Yeah.
Like, there needs to be some massive scientific breakthroughs that come out that's going to really add years to our life, right?
Massive, yeah.
They may or may not come. I mean, there's excitement around it, but really the way you add years to your life, in my opinion right now, is if I could live to be 100 years old and still be able to travel and meet my great-grandchildren, like those are massive opportunities that humans have not typically had.
I know, and that's really what it's all about, right? So the way I think about practice, and I know you think about this the same way, is that how can we keep people healthy for as long as possible?
Right.
And then that often means not just looking at markers that would be optimized for your age, but markers that would be optimized for somebody that would be at their prime of their life. And so I think you know that we have a nonprofit that I help run called Health Optimization Medicine in Practice.
Right.
And this is a nonprofit that's training practitioners how to optimize health rather than treat disease. And the focus is on keeping people healthy rather than looking at how you can look at the root causes of disease. I mean, and then there's a big reason for that. And we need that too. That's much better. Functional medicine, for example, is great, much better than conventional medicine as far as preventative medicine and from a root cause perspective. But it's not looking at how you can keep people healthy, right? And so let's focus on these other aspects of health, which is optimizing for when we were the most vital, usually between 21 and 30 years of age. And so when we're looking at nutrient networks, hormone networks, the gut, that's what we're looking to do. And that's kind of the goal of what, my practice is and what I do personally as well with my patients.
Yeah, no, that's fantastic. And, for anyone out there that's in their 20s listening to this, one of the first things that you should do is get a full set of biomarkers, right? Because this is when you're in your optimal.
Become a blood boy, maybe? Just kidding.
Maybe not a blood boy, but at least a few vials of blood, get your hormone levels checked, your metabolism checked, et cetera. First of all, people are getting chronic disease younger and younger.
Much younger,
but
that's true, yeah.
Even if you're feeling great in your 20s, it's so good to have those numbers so you know where you want your numbers to stay for the rest of your life. That's kind of what you're talking about.
Yeah, I mean, and also understanding that we know what those levels should be for our overall lifespan in this point, right? So like in the sense that if you're 20 to 30 now, fantastic. But if you're 60 or 70, like your marker shouldn't be normal for 60 or normal for 70. They should be optimized for when you were 21 to 30 or somewhere around that age. And that's the marker range that we really look at health optimization medicine and practice. We call it home hope for short. And that's really where I think we need to be looking at for the future of medicine. The future of medicine is not just to focus on medical treatment, medical interventions, but actually focusing on health and optimizing health. And because once you do that, you create a foundational framework, you optimize vitamins, minerals, nutrients, and cofactors, you optimize the gut, lifestyle, diet, like whatever diseases or conditions you may have, they're likely going to get better on their own or at least significantly improve, even if you don't directly address them with something. Sometimes you have to directly address it, and that's totally okay. And we have a lot of really great docs in our group, especially that are doing things with chronic disease and long COVID and things like that, and that's really important. But it doesn't take away the fact that you need to think about what's happening underneath the hood and optimizing those kind of biomarkers that we're describing. So
yeah, exactly. And that's the whole thesis around Next Health. My clinic practice is we want to not just reverse chronic disease, which is a great goal in and of itself, but we want people to feel incredible and have that vitality and that kind of spark and that mental clarity you have when you're in your 20s for the rest of your life. And that's what we're talking about here.
Yeah, exactly. And that's what we're doing at Home Hope, our nonprofit, and trying to train practitioners that are interested in doing this in their own practice, but don't have a framework for it. And when I was looking as a hyperbaric physician for many years, for that foundation, I was looking at functional medicine. I looked at other kinds of programs. I really didn't feel aligned until I met a colleague named Dr. Ted Achacoso, who started health optimization medicine and practice. And that was the focus shift that I needed, because my clinical practice really started off as kind of focusing on hyperbaric medicine as the main thing that I did. But I realized very quickly that if you were just focused on hyperbaric therapy, you were missing the boat in a lot of cases, especially in chronic disease and long-term illness or long-term goals. And so you needed a foundation, you needed a framework to kind of have that sit under or sit over, I guess, hyperbaric therapy being like great. But if you didn't have that sort of foundational piece, I just found that if you had like somebody with a chronic issue, a long-term goal, you're typically missing a significant amount of impact that you can make on their life, whether they got into a hyperbaric chamber or not. That kind of thing.
Exactly. So what type of training did you do in your medical career after medical school?
So I was in medical school in Baltimore at the University of Maryland. I did my training at the University of Maryland in internal medicine. I did 3 years internal medicine, and then I worked primarily as a hospitalist for many years, and then I was doing hyperbaric therapy on the side kind of deal. As my family was growing, my wife was also a physician, and she did a fellowship in allergy immunology at Stanford, and so we moved out to California from there. I became medical director of a number of hyperbaric facilities in the early 2000 or 2000 teens, what do we call them then? 2010. It was around 2012, 2013 that I became medical director of a hyperbaric facility. And then that's really kind of where I started learning the ropes about being a hyperbaric physician and understanding the massive potential benefits, but also the potential, not downsides, but the potential pitfalls that can happen if you weren't thinking about some of these foundational things. And so that's really what my training really was kind of on the ground as a hyperbaric physician. And then in 2017, I met my colleague, Dr. Ted, who had this training program called Health Optimization Medicine and Practice, and I trained in that. And then I started using that in clinical practice as well in 2019 or so. So not that long ago now. And then I kind of became more of a virtual consultant on the hyperbaric side. I was medical director for a few facilities, but then I decided I could help a lot more people if I was doing it more virtually. And so I consult with people all over the world that are interested in learning how to use hyperbaric therapy either on its own or like in the context of an integrative perspective, which is I typically recommend, and typically that's my focus. And so when people call me or talk to me about hyperbaric therapy, like 80% of what I say has nothing to do with hyperbaric therapy at all. And that sometimes can be frustrating for people. I'm like, well, we'll get there. Hyperbaric therapy, that's the easy part. The more interesting and the more sustainable part is the part that's going to optimize your health, and how we're going to look at that as like your foundation so you can actually benefit the most from being in a chamber. And it's actually a funny story. I was actually disinvited from speaking at a hyperbaric conference in 2021, I think. It was during the pandemic. Because the title of my talk was going to be, "Please do not put them in the chamber."
Oh my gosh.
Because
they disinvited you.
Yeah, I got disinvited. I mean, there's probably a couple other reasons. That was the main one, though. I tend to, because I didn't have like allegiance with a certain chamber manufacturer. I really just wanted to help people as much as I could in a more holistic way. And if you have a hammer, everything looks like a nail, right? So that if you have a hyperbaric facility, you think everybody should go into a hyperbaric chamber. Right. If you're a cardiologist, you think everybody needs an echo or an EKG. If you're at whatever else, you can just, if you're a pulmonologist, you're like thinking of chest x-rays or whatever it might be. So what I found really, really impactful is if you could just wait in a lot of people, just wait and optimize them for 3 to 6 months before them actually getting into the chamber, they would do so much better long-term. And this was just transformative to my clinical practice and how I kind of operate overall.
Right. Yeah. So, I think a lot of people listening to this podcast might not even know what hyperbaric medicine is. And so I'd love to dive in deep. Where I trained at the Mayo Clinic, we used hyperbaric medicine as well. Sure. We had people come to us with large wounds mainly that would go into the hyperbaric chamber. So this is one of those technologies that's kind of been locked up in disease care world, I call it.
Sure.
And now we're seeing it brought out more into disease reversal, health optimization. But, can you give people a quick primer on what is hyperbaric medicine?
Sure.
Yeah.
So hyperbaric therapy is a combination of increased atmospheric pressure and increased inspired oxygen. Mm-hmm. And so we combine those two things together to drive a huge amount of oxygen into the circulation. So here's a quick primer on oxygen just to kind of go over that. So oxygen is typically carried on red blood cells. Red blood cells actually have 250 million sites where oxygen can bind. They're called hemoglobin, and hemoglobin actually has 4 sites that that oxygen can bind. So in total, every red blood cell has 1 billion oxygen molecules. Just fun fact, everybody. So that's red blood cells are how we carry oxygen. And then why do we need oxygen? Of course, we need oxygen to be the final electron acceptor in our mitochondria so that we can make ATP our energy currency. Fun fact as well, we make about 165 pounds of ATP every day. So it's a huge amount of oxygen that we need to make all of that energy. So it's all being carried on red blood cells. So how can you increase your oxygen carrying capacity? Well, you can come to live in Colorado or go to Aspen as you do and hang out for about 90 days. And after you do, you're going to increase the number of red blood cells in circulation because you release a hormone called epogen, or EPO for short. This is also the doping drug, as you know. Lance Armstrong and other cyclists were very famous for this because if you take EPO or you go to altitude where EPO is released, you're going to get a number of increased red blood cells in circulation. As a result of that, you're going to carry more oxygen because you have more red blood cells. The other way to do this, of course, is to inject yourself with EPO, which you can do, which people do, especially if you have kidney disease, because your kidneys make the epogen itself. And then you can also give yourself a transfusion of blood. This has also been done, and of course not legal for races and cycling and things like that and other sports because it's going to increase your oxygen carrying capacity. Now, what we do in a hyperbaric chamber, though, is different. We increase the amount of oxygen in circulation by driving oxygen into the liquid of your bloodstream. Your red blood cells are already saturated. We can actually still get more oxygen in because we can saturate into the liquid. And this is because we're simulating the pressure you feel under a certain amount of seawater. So water is extremely heavy, and it's that heaviness that actually changes your physiology. It's a physics law called Henry's law, that basically the more pressure you put on a gas, the more of that gas is going to go from a gaseous form to a liquid form. So as a result of putting pressure or simulating the pressure you feel under a certain amount of seawater, if you look above, you're 30 feet below the sea, you're looking above, you don't feel that pressure, but it's a significant amount of pressure. Water's very heavy. If you carry a bucket of water, it's heavy, right? So that heaviness that we simulate allows you to drive 1,200% more oxygen, or even more than that, in circulation, depending on the circumstance. And then as a result of that, so you have all that oxygen in circulation, there are basically 3 things that are happening, okay? The first is that you're getting more oxygen delivery. That's pretty obvious. So if you've had an acute injury, stroke, heart attack, traumatic brain injury, spinal cord injury, one of your limbs is hanging off or something like that, hyperbaric therapy used in the immediate setting can be very, very powerful, and it's been shown in various studies to actually reverse or mitigate significant damage as a result of that. So getting oxygen circulation, really important, right? Number 2 is that all that oxygen creates more energy. That's important, but also creates more stress on the system. It's called oxidative stress or hormetic stress in this case. And what that's going to do is going to shift your epigenetics, the way your genes are being transcribed on your DNA and how they're expressed as a result of that epigenetic shift and that oxidative load. That oxidative load is also going to release more stem cells. It's going to enhance your immune system function. It's also going to kill bugs, especially that do not like high oxygen environments. And the third thing that really happens is that there's the pressure itself in the chamber. The pressure itself causes a kind of like a micro massage to your blood vessels and your lymphatics. So it improves flow, it improves lymphatic flow, improves detoxification, and it also has some energy production capacity just with the shearing or with the pressure sensation on the cells themselves because of the pressure. So as a result of all of that, you have reversing low oxygen, you have decreased inflammation, you have decreased swelling, you have immune system activation, you have killing bugs, you have lymphatic flow, and you have detoxification, and something else. I think that's most of them.
Wow. That's a great primer on it. So basically what we're doing is we're increasing the amount of oxygen that is being delivered to all of our tissues. So we have more ATP production, more oxidative stress as well.
Yes.
And we're also having some mechanical effect also on our blood vessels and our lymphatics. And so those are the three primary mechanisms that this is exerting an effect in our body.
Yep.
But, you do that at a microcellular level to every cell in your body. And whether it's a brain cell, a heart cell, a liver cell, a kidney cell, muscle cell, they're all functioning better because of this therapy.
Hypothetically, right? And that's kind of what we were kind of alluding to all here, right? Because sure, getting more oxygen in circulation sounds great, unless you're creating a huge amount of oxidative stress, and the person that you're giving the oxygen to cannot tolerate that oxidative stress because they're already inflamed, they're already antioxidant deficient. Because what happens is because all that oxidative stress is causing all those positive changes, but if you don't have a neutralizing effect, what they've shown in various studies, it takes about 3 days for the average person to mount an antioxidant response. And that's appropriate because that's what we want, enough oxidative stress to cause those changes, but not so much that it's causing damage to the system, right? So typically, as we think about hormetic stress, like exercise or sauna, like these are causing good stresses to the body, but it's not going to be a good stress for everybody. And so in some of the first people that I was treating in the chamber, they got terribly sick afterwards. And they were already very sick when they were going into the chamber. I'm like, well, what's happening here, right? So trying to support them with antioxidants, trying to do things that would kind of mitigate some of that damage, or that potential damage, or kind of more distress on the system, I would say, is usually not permanent damage. It's usually somebody will feel worse and then they can't go back into the chamber for a couple of days. And that's usually a sign that they need to have more optimization before they go in overall. So, but to take a back step, it is those three mechanisms. And then acutely all that's happening immediately when you get into the chamber, right? But then long-term, those epigenetic shifts, you have new blood vessels, so angiogenesis. You have downregulation of inflammatory markers. So your inflammatory mediators like your interleukins, your TNF-alpha of the world. You also have a improvement in maturation of those stem cells into the types of stem cells or types of mature tissue that are needed in various areas. And they tend to hone to the areas where they need to go. So if you have a brain injury, more going to go there. If you have more of a knee injury, you're going to have more that go in there too. So,
Stem cells can kind of find their way to where they're most needed and exert their effects at those areas.
Exactly.
And just by using hyperbaric oxygen therapy, what you're saying is you stimulate the stem cells to kind of just go out there and do their job.
Yeah, exactly. I mean, there's an exponential release of stem cells from your bone marrow as a result of just going into the chamber. And that's that oxidative stress piece that we're talking about. So, so again, that's, for me, the energy metabolism piece of things was just my foray into learning that I needed to have a foundational framework because you need to have the machinery to be able to make energy and to detox from the energy that you make if you're going to successfully accomplish a hyperbaric protocol. I mean, typically protocols, if you have an acute issue, are going to be somewhere like maybe 3, maybe even 1 session, but 5, 10 sessions-ish. But if you have more of a chronic issue, a long-term goal, then you're looking at, so for example, if you have mild cognitive impairment, or if you have a chronic infection, or if you have so many different options, I can't even think of any, but if you have if you're looking at like fertility or like optimization, longevity, like these things are more long-term shifts in that epigenetics that matter, right? So, and those protocols can be 20, 40, 60 sessions, sometimes more, 5 days a week to get the effect that you want.
Right.
So if you want to optimize your time in the chamber, you're spending all that time anyway. Like oftentimes it's better to wait 3 or 6 months, get yourself optimized or get yourself ready to go in the chamber is what I say.
Yes.
Like, and people that are super sick, super chronically sick, I usually have them say like, look, you need to be about 60 or 70% better before hyperbaric therapy, especially at the deeper pressures, is going to be effective. So for me, it all came down to energy metabolism, understanding the machinery of production. So do you have the machinery that's able to allow you to make energy? And then do you have the machinery that's able to allow you to detox from the energy that you make so that, that you can really survive and thrive in a vital way in the, going through hyperbaric chambers.
Right. The balance is so critical to this therapy. But just taking a step back, let's give people a kind of a visualization of what it's like to go through a hyperbaric protocol. I think a lot of people, when they hear hyperbaric, they think about, Michael Jackson sleeping in the chamber.
Yeah.
They think about maybe if they have a little bit of knowledge about it, they know that there's like these soft chambers you can have at your house. There's hard chambers you can find at facilities. And then there's facilities that have like these futuristic looking capsules, look like you're almost in cryostasis. I told you I used to have the Beverly Hills hyperbaric facility here. And maybe kind of describing like what does a protocol look like? How's the experience of being in a chamber? And what are all these different chambers?
Sure. Well, Michael Jackson's a good story because he was filmed or photographed in the chamber, supposedly sleeping in it. But what he actually was using it for was he was burned in the Pepsi commercial back in the 1980s. And so he's using it to heal third-degree burns that he had on his head as a result of that. When he was done with his chamber, he actually donated it to Cedars-Sinai here in LA. And so, of course, the tabloids will do what they do. And he was filmed. I have some photos of that that I found over the years of him, quote unquote, sleeping in the chamber. But I think it was more just sleeping in the chamber for pictures, as far as I could tell. But so, I mean, what it comes down to it is that there's multiple different types of chambers available, right? There are soft chambers that typically go to milder pressures. These are usually made out of some sort of nylon or polyurethane kind of material. And they can be used in the home. Sometimes you'll find them in clinics as well. And you have medical grade chambers that go to a deeper chamber, deeper pressures. There are what are called monoplace chambers, which are single occupancy chambers. So it's one person goes in. They can be fully translucent, so you can see all the way on the outside. Sometimes they look like submarines, depending on the situation. And so then you have what are called multiplace chambers. And multiplace chambers where multiple people can get treated all at the same time. They look like submarines, and these are where you'll find them a lot of times in academic facilities, and you'll also find them at diving locations around the world, because that's where hyperbaric therapy got its start, is actually as a treatment for diving injury or the bends or decompression illness. So the experience is relatively the same, doesn't really depend on the chamber, in the sense that when you go in there, you're going to feel like your ears are changing pressure, just like if you're on a plane or a train, but it's usually not as significant. It's usually more significant, being on a plane, because it's going to be more depending on how deep you're going to go, right? And so while pretend you're starting at 0 feet of seawater, and you're diving, as we call it, diving down below the sea, simulating that up to a certain, or down to a certain pressure. So you're going to, let's say, 33 feet of seawater, okay? And so 33 feet of seawater is what we call 2 ATA in our parlance, in our nomenclature in hyperbaric medicine. And so as you're going down to pressure, your ears are going to be changing and as well, and they're going to have to be popping. So if you have any issues with that, the pressure has to stop. You have to wait, but 95% of people don't really have much of an issue. Of the 5% that do, oftentimes cleaning out your ears with some wax typically does the job. But in general, it's usually pretty well tolerated, but it takes a little bit of time to get used to. Then when you get down to pressure, you stay there depending on the protocol, you can stay there for 30 minutes, 45, 60, 90, 120, depending on the situation. And then while you're there, your ears are no longer pressurizing. Now, sometimes what we do is when we're at that stable pressure is that we do something called an air brake. So so that goes with the oxygen. So typically you're getting oxygen either via, depending on the chamber, you can get it via nasal cannula, you can get it via face mask, you can get it via hood. You can also get it 100% in the chamber itself, depending on the situation. Most medical grade facilities will use masks, although there are some that will use 100% oxygen in those single occupancy monoplace chambers too. Right. So what happens is you're breathing on oxygen, you have oxygen on while you're kind of diving down. When you get down to pressure, you're hanging out at pressure, but then every 20 minutes or so, what we'll typically do is we'll have you stop breathing the oxygen and just breathe air instead. And that's called an air brake. Typically, we're using those more in pressures about 1.8 and below, but more people are using it at milder pressures too. And the reason for the air brake is that, number one, it decreases the risk of oxygen toxicity. So we were talking about that oxidative stress before. Right. The deeper you go, the more risk you have. So at 3.0, or 3 atmospheres of pressure, you do have a risk of having a seizure at that pressure after about 15 or 20 minutes. And so, interestingly, if you take some ketones ahead of time, you actually extend that time for significantly. This is where people like Dom D'Agostino got all his Office of Naval Research.
I just talked to Dom yesterday.
Oh, nice. Yeah. Good timing. Yeah. And so that's how I first met Dom, was through some of his work using ketogenic diets, actually for cancer and things, along with hyperbaric oxygen therapy. But he got his start at the Office of Navy Research because they were doing how far they could go without having a seizure, breathing 100% oxygen at 3 atmospheres. So in that respect, you're using this oxygen, which can cause stress in the system. So you have to be aware of that, like we were talking about. And so air brakes can be helpful, and we use it for the decreasing risk of oxygen toxicity. seizures are very rare, I should say, in a hyperbaric chamber. I've only seen maybe 2 in my whole career. So very, very, very rare. But you mitigate them by this air brake phenomenon. But there looks to be a positive potential with these air brakes, not only to have mitigation of oxygen toxicity, but also it looks like these air brakes release certain factors that simulate actually you being at altitude for those 5 minutes. And that's called the hyperoxic-hypoxic paradox.
Yes, makes sense. Right.
And the idea is that because you're going from, let's say, 100% oxygen to 21% oxygen, that delta, that change, your body sees that as you going to altitude, basically, going to a hypoxic state, even if you're going back to normal amounts of oxygen, which I should have also mentioned, there's 21% oxygen in the air at sea level. Yes. Okay, just to be clear. And then there's, where I live in Colorado, it's about 16%. So, and in the chamber, we can go up to 100%, of course, right? So that delta causes this factor called hypoxic inducible factor to be released. And that increases blood vessel formulation, stem cell release, mitochondrial biogenesis as well. And that's been looked at as well in various studies. So that's really the experience. And then at the end of the experience, you kind of come up. You depressurize, come back to the surface, and you feel like your ears are popping again. Usually easier to come back up to the surface, back up from pressure rather than going down. My evolutionary reason for this is that when we were designed, we weren't designed to breathe underwater, obviously. And so if we were diving underneath the water, it should be harder for us to go down so that we didn't want to do it. Right. But if we were down there, we need to get up. We need to get the hell up as fast as possible. So without injuring our ears. So it's usually easier to go back up.
That's right. So, I think what's important about the hyperbaric treatment is that you're actually using multiple modalities. You're doing these air brakes. You're using oxygen at higher concentrations. The air brakes are giving you that effect where you're going hyperoxic, hypoxic, as you're saying, but then also you're using the pressure as well to increase the amount of oxygen in your bloodstream as well. So there's multiple different mechanisms you're using simultaneously. And that's why it's so important to have someone such as yourself really design a protocol that fits what your particular physiology needs and what you're kind of going after, right?
Yeah, it got me a little crazy in 2017, 2018 timeframe when I started doing more of my independent consulting outside of being a medical director. I would just find that there was so little education out there as to what people should do. And there was tons of companies, and now there's even more, that are making chambers that will give people a chamber and say, good luck.
Yeah.
And then they find me 6 months or a year later. I'm like, what were you doing? Why did you? And then some of these companies are actually giving protocols to these people, and these are companies. They're not medical doctors, and it's become a whole thing. So for me, that's why I really decided a number of years ago to start creating more of an ecosystem, talking more about it, obviously, and educating people. But I have my own company that makes hyperbaric technology. But really, our goal is to try to find ways to how people learn how to actually make more individualized protocols depending on their markers, like their wearables, like their blood data eventually, and also being able to understand what's happening in their actual technologies. Hyperbaric chambers being the first thing, but also looking at things like red lights and cold plunges and saunas. Like, we actually have Bluetooth connectivity to all those different types of technology, so you can use them all like on a phone app to like learn how to integrate all this stuff together. So like that's really where I think I felt that my world was going. It's like, well, how do you work on all this stuff together, Doc? Like, I have a hyperbaric chamber, or I want to use one, then I have lights, and I have sauna, and I have these laboratory markers, and I have these conditions, and like, well, how do you put it all together, right? So my consulting practice is a lot of that. That's what I do. That's what I do all the time, every day, every week. But also I wanted to find a way to kind of bring it out to more people as well. So we're working on that. Yeah.
I think what you're talking about there is like really using the N of one kind of methodology where you're looking at your own data and seeing how these treatments are affecting you. Like you have an Oura ring on, I have one on too. And it's just, that constant tracking of your own data tells you how effective the therapy is, or if it's actually harming you and if you need to do something different, right?
Right. Yeah, we're actually we're coming out with something cool where you can monitor your health data real time while you're doing the technology. So like while you're in hyperbaric chamber, you can actually have your Oura on and actually looking at what's happening like in our own dashboard. So that it's all in the same location. So I just got really tired, as you have, like everything's all kind of siloed out. So it's difficult. And so integrating things together is kind of how I really operate. As I kind of alluded to, hyperbaric therapy is kind of a smokescreen for me. Like it's something that I absolutely love. I do a lot of, and I work with every day almost. But it's not the first thing that I'm usually recommending for people, unless it's more of an acute issue. If it's an acute issue, do not pass go, except for go to the hospital if you need to, of course, and then get stabilized. Like, although there are stories of these old hyperbaric Navy docs having strokes and just going downstairs in the chamber and reversing them.
Are you serious?
Yeah. I was actually, when I got trained back in 2012 or 2013, the doc got up and talked that story. And then his son also was involved. He's like, no, Dad, you can't tell that story. You can't tell it anymore. It's going to get us in trouble. Yeah. Because, that's what these guys, they're all cowboys, right? But in general, you want to get stabilized, right? Yeah. And then hyperbaric therapy is a fantastic tool for acute injury. So that could be trauma, it could be ischemia, like we were talking about, stroke, but also could be like a surgery or or just a regular musculoskeletal injury. Like if there's an inflammatory component, like you're going to see massive amounts of improvement. But I'm sure you have something similar, but I call mine an integrative strategy. I call it like my educationally throwing shit at the wall strategy, right? Yeah. So if you have, excuse the cursing, but is it the first time that anybody's cursed on this podcast? I'm hoping.
I don't know. Maybe. Yeah, maybe it might be.
Yeah. All right. Well, you're welcome. Anyway, so when I'm thinking about that strategy, it's more of a holistic one, right? Sure. It's not just about putting them in the chamber. It's like, what is their diet going to be? What are their supplements going to be? What are their, practices that what do we want them to have to do?
Absolutely.
What other surveillance do we need so that we can kind of see and we can dial all that in? Right. But, long term, if you have more time, of course, then it's not educationally throwing shit at the wall. It's more like, let's have a intentional strategy based on your labs, based on your data, based on your lifestyle, your diet, things that we need to kind of optimize. Right. Like if you're an endurance athlete, we have a protocol for that. If you're looking for longevity, we have protocols for that. But it's not just about, yes, I have hyperbaric protocols for that.
Yes.
I can tell you that in 3 seconds.
Right.
But that's not necessarily what you need right now. And maybe it would be modified. A good example is that there was a study that got a lot of attention in 2022, I think it came out. It was the Israelis. They published a study on telomere length, senescent cells. Yep. They did 60 hyperbaric sessions, 60. They treated them at 2.0, Monday through Friday for 3 months.
Right.
And they saw
45 minutes each
90,
session?
No, so it
90 minutes?
It was in total about 2 hours of pressure.
2 hours of pressure.
What they would do is they did 90 minutes of oxygen and they did air breaks as well.
Got it.
So in total, it's about 120 minutes.
Yep.
And so they saw a reversal of telomere attrition. So there's a 20% increase in telomere size, or telomere length, excuse me. And then there was a significant decline in senescent cell populations. Right. Senescent cells are these zombie cells that I'm sure you've spoken about before. That increases as we get older. They don't divide. They don't die. They just kind of cause inflammation. They're associated with degeneration.
These are all longevity markers. Yeah, exactly. You want low senescent cells, longer telomeres, basically.
Hypothetically, yeah. I mean, especially with the senescent cells, there's some more controversy on the telomere side.
Right, there is.
And I'm not convinced that it matters as much as, but what really convinced me on the study was the senescent cell populations. Sure. Now, there's, of course, controversy. What types of cells are you looking at? And there's all these other things. But my sense is what's happening is that hyperbaric therapy is actually regenerating those cells.
Got it.
They could just be apoptosing and dying as well, which would be fine. But my sense is the way hyperbaric therapy works is that it can improve mitochondrial function. And then as a result of that, you're going to get these cells to kind of regenerate themselves and start working again.
So it's actually healing the senescent cells and back into functional cells. So that
that's my sense.
Yeah, interesting.
But I don't know for sure. What was interesting about that study too is that the most senescent cell downregulation or decrease in population was around treatment 30 or so.
Right.
So, but they did 60 hyperbaric sessions. So what was interesting for me is I look at this study. They didn't change anybody's diet. Of course they can't because it's a study. Sure. They didn't change anybody's lifestyle. They didn't do anything except for putting them in a chamber. So in my experience, we can do a significant amount of benefit, if not the entire benefit, in 30 to 40 sessions in most people, if they're looking at optimizing their health and foundational markers and, working with me or working with you or something where they're really looking at, looking at this as a longevity health span piece and then adding hyperbaric therapy on top of that.
Right. Yeah. So going back to the chamber itself, I mean, you have different chambers, different types of chambers, hard, soft chambers, and the softer chambers don't get up to 2 atmospheres.
Sure, yes.
So can you talk a little about the number of atmospheres? And, a lot of times I hear people in Next Health talking to each other outside the chamber is like, oh, I got a 3 atmosphere chamber down here that I'm going to go to.
No.
And it's like, really? So talk a little bit about you alluded to the number of atmospheres and how you think about that and how people should think about that. And also the oxygen concentration that you're getting.
Yeah, so as we were talking about before, we talk about ATA, atmosphere is absolute. That's kind of our nomenclature.
Right.
It's equivalent to a certain amount of feet of seawater.
Yes.
So that's the other way to think about it. So if you're in a mild unit, typically, again, they're soft-sided. They usually go to about 1.5 atmospheres at max, and that's going to be about 20 feet of seawater-ish. Then you have your monoplace, the hard shell chambers that go to about 3 atmospheres. That's equivalent to about 66 feet of seawater. And then your multiplace chambers can go as deep as you need to, because the multiplace need to go as deep as anybody was diving underneath the water.
Exactly.
And then I have, these could be saturation divers, people building tunnels and things like that could go super, super deep. So they have to be able to go that deep. So in essence, that's the differentiations in pressure. When it comes to indications, which I think is important, the soft chambers or the mild-sided units have been mostly studied for neurologic and neurocognitive optimization. In clinical practice, I see it also great for what I call day-to-day operations, wellness, like jet lag and performance and recovery. It's really nice to have the mild chambers just for those things. But if you're looking at the longevity studies, or at least the ones that we were alluding to, that really starts at about 2 atmospheres. And so in theory, it would be nice to have the option to go to both types of pressures. But in practice, it's hard because they're more expensive to go to deeper pressures. So a lot of people have the soft chambers at their house. More people are getting the hard chambers at their house now too, which is fine. But I think you can get a significant amount of benefit with the mild units, especially from a neurocognitive perspective. But even from a physical systemic perspective too, if you're doing the other stuff, if you're optimizing vitamins, minerals, nutrients, your cofactors, your energy metabolism, taking some methylene blue, other kinds of things. And then you're also adding other therapies like you have, like red light or sauna. Or if you're, the way I think about it is that how can I enhance the capacity for the system to make more energy? And then also, how can I enhance the flow of energy to where we want it to go, like the flow of oxygen in this case, right? And so that means enhancing blood vessel dilation, right? So what also can happen in the chamber, and hyperbaric chamber, is the deeper you go, the more vasoconstriction you get too. So this is something you can mitigate by using various things ahead of going in the chamber if vasoconstriction is not what you want, right? So if you've had a brain injury and you have swelling, you need that vasoconstriction because that's going to stop the swelling and stop your brain from swelling, which is important. But in essence, from like a longevity performance optimization, you don't need that as much, right? And so you want to maybe mitigate some of that vasoconstriction. So in essence, the mild units are really for neurocognitive optimization, day-to-day wellness, I feel like, especially from a brain health perspective. But one thing that I always like to point out is that a lot of these soft chamber companies, what they'll say is that, oh no, all you need to do is more hyperbaric sessions in a mild unit, and that's going to be the same as going to less sessions in a deeper unit. There's completely no basis for that in reality. They call it that like an oxygen exposure, but what they forget to mention is that when you're getting oxygen in circulation, you're going to have a diffusion of that oxygen outside of a blood vessel to a certain amount, length. And that's not going to change at 1.3 or 1.5. Compared to 2.0, it's going to be about double. So there's no real comparison. I mean, you can make the comparison, but it's a false comparison if you're trying to make that comparison. So, so deeper pressures or milder pressures for longer does not equal deeper pressures for shorter. So I think that's important to mention as well.
Yeah, for sure. Now, some of these monoplace chambers, like you said, you can be in there at 100% oxygen, but that gets really dangerous, right? Because 100% oxygen environment is highly flammable as well. So safety-wise, what are your concerns, and how? Let's talk about the oxygen concentrations as well, and where you should be doing these types of therapies, and how to keep it safe.
Yeah, I talk with my hands. I'm keeping the microphones here.
Me too. I talk with my hands too.
So we're just kind of like, we're shaking here. So when it comes to oxygen, there's a number of different ways for it to be administered. What you're talking about with 100% oxygen, usually it's only administered that way in the medical grade monoplace chambers. And it actually can be really nice for certain types of patients that have a hard time putting something on their face, if they've had a stroke or if they've had other injuries or if they've had plastic surgery on their face or something like that. So there can be utility for it. But if you're going to go to a place that has 100% oxygen, you really have to make sure that they have really good safety protocols in place. So I work with a number of facilities in New York and California and other places, and Northern California as well as Southern, that use 100% oxygen. Totally fine. But everybody's going in scrubs. You're going in with your mother, what your mom gave you otherwise, right? And you take off everything, jewelry, makeup, earrings, watches, everything.
No electronics. You can't have your phone in there, none of that.
Right. So it's definitely a higher risk from a flammability perspective. So, most facilities will use, even with the monos that go to deeper pressure, they'll use a mask. And so that could be like what's called a non-rebreather, or it could be, or you can use a hood as well, where they put a hood on top of you that gives you oxygen around your head, but not the rest of your body, which decreases the risk of flammability as well. In the soft-sided units, you can get nasal cannula, you can get face mask, or you can get no oxygen at all as well. So, another fun fact here is that if you're at 1.3 atmospheres, which is about 15 to 20 feet of seawater, and you are just in a hyperbaric chamber without any extra oxygen, you're getting about 46% more oxygen in circulation.
Oh, okay.
And this becomes important because a lot of the studies that were looking at hyperbaric therapy, they would compare somebody going to 1.3 without any oxygen to somebody that was going to more pressure, more oxygen. And they were calling this a sham-controlled study, but it's not really, because you were giving that patient that was getting the sham, you were getting them 46% more oxygen.
Right, exactly.
So that's not really a sham.
That's not a sham study, right?
This became a problem in a lot of the traumatic brain injury work because the TBI patients do better usually at the milder pressures. So if you're comparing a 1.3 getting air, which is 46% more oxygen in circulation, to a 1.5 with 100% oxygen, they are getting more oxygen for sure at 1.5, but they're also getting oxygen at 1.3,
yes,
right? So like, how do you make that? So it's, there's still benefit at 1.3 without any extra oxygen, especially for brain and neurologic as well. So it's important. And so, the oxygen is usually either given via like a oxygen concentrator. So there can be an oxygen concentrator outside of the chamber. It could be bottled oxygen, that's compressed oxygen, if it's at the deeper pressures. It also could be liquid O2 as well, depending on the situation. So, but yeah, oxygen, pressure, the combination. Like often you'll get the question, I get the question still, like, why can't I just breathe oxygen, right? Yeah. And it's because, no, you need the pressure to drive the oxygen circulation, right? And that's key. So, and pressure is less appreciated in the hyperbaric field because everybody thinks, oh, it's oxygen, oxygen, oxygen. No, it's not just the oxygen. It's the oxygen because of the pressure.
Right.
And the pressure itself having multiple different physiologic shifts as well, as we were discussing earlier. So
right. Have you seen some of these newer chambers that have come out that actually put you into a hypo pressure environment and and then they bring you back and forth? Yeah. Can you kind of contrast those newer chambers to the hyperbaric chambers, and what are the differences that you can use them for?
So there's a couple different companies that have these hyperbaric chambers, and what they do is they start you at sea level, and then they vary the pressure, the altitude very, very quickly, very, very fast. And I think there is something to them overall. They are causing a hypoxic stress. And it's basically like the oxygen air breaks that we make in the hyperbaric chamber, but like constantly for 60 or 90 minutes.
Right.
And so what I found is that if you're a performance athlete, it could be a huge performance boost to do that. But if you're already pretty sick or have like medical issues, you have to be careful because it could be too much stress on the system to have that much of a hypoxic stress overall.
Right.
But it is causing a lymphatic flow as well, so that the pressure altitude changes are increasing lymphatic flow. So there are some benefits, absolutely. And I have some friends that, very much into using it for performance, for athletic pursuits. And overall, I think that, it's one of those things where my sense is that if you're relatively well optimized already, that I think hypoxic stress can be really good for you.
Yeah.
But I think my concern is people doing it too much, too often. But I think that there's definitely something there too.
Yeah, it seems like it's utilizing, we talked about the three mechanisms of why hyperbaric oxygen is working.
Yeah.
One of them being the kind of air brakes where we're changing pressures on people. So this new chamber is utilizing that air brake methodology to create that one effect, but you're not getting the oxygen driven into the cells which you get the hyperbaric therapy.
Yeah. So if you're getting real fancy, like some of my friends they'll start doing the hypoxic training and then they'll go and do hyperoxic training after that. But you have to be really careful with that because it could be a significant stress on the system if you're not used to it. But I think really where it comes down to is I think both are really helpful overall. Yeah. And I think what's very similar about the two of them is that you have these air brakes in a hyperbaric chamber, and it's very similar to what's happening when you're in these kind of altitude chambers. Sure. But the altitude chambers are more constantly changing your pressure up and down, up and down, up and down. And so that's stressful to the system, more so than I think hyperbaric therapy is overall.
Got it.
I don't. That's not where I immediately go to with patients,
right?
Or even my endurance athletes and performers. It's like let's do hyperbaric therapy. Let's work on that increased oxygenation piece first. Let's optimize your mitochondrial function that way, and then you bring more. The hypoxic stress is going to actually work better overall. That's
exactly right. And so I think there's an important distinction to be made because I think that for people like you mentioned, traumatic brain injury. So we have a lot of football players that come into here after games sometimes that are trying to mitigate the effects of that, and we also have some patients that have had maybe strokes that are trying to recover from their strokes, post-surgical patients.
For sure.
All of these are people that need hyperoxygenation to their brain and their tissues, right? As they're healing.
Exactly, yeah.
So really, the hyperbaric chamber is going to be the best for that. Now, if you're looking at performance and utilizing some of the pressure shifts to create better performance, yes, the hypobaric chamber is definitely an option there as well.
Well said. Well said, yeah.
Okay, let's talk about, I want to dive in a little bit because I think this gets confusing for people. This mechanism that occurs in our biology of hyper-oxygenated stress and the recovery from that and the utilization of antioxidants. We were told for years that we need antioxidants. So why are we using hyperbaric therapy to create more oxidative stress? So let's talk about that balance that occurs at a cellular level a little bit.
Yeah, so we know from various studies out there that just supplementing with antioxidants doesn't do the trick, especially if you're just using one antioxidant and not thinking about all the other antioxidants in the system. And then what happens with antioxidants is that you can cause oxidative stress because of those in too much over time. So, but in essence, what we think about with is a balance, as you mentioned. And so what hyperbaric therapy is doing is shifting that into an imbalance for a short period of time.
Yes.
But the hope is that your system is optimized enough so that you have enough antioxidants in the system to be able to balance out the oxidative stress that just happened. The challenge, though, as we were alluding to earlier, though, is that a lot of people do not have that capacity. They don't have the capacity to balance out that oxidative load. And so what does this manifest as? It manifests as fatigue. It manifests as muscle pain, joint aches, concentration problems, GI issues. These are kind of like your detox kinds of symptoms where your body's trying to do something about it, but it doesn't have the capacity to do it. So I'm always very cognizant when somebody's going into a hyperbaric chamber, do they have the capacity to create an antioxidant response? And so we need an antioxidant response, but we also need oxidative responses too. So that our body responds to these oxidative loads by trying to optimize it itself, right? And so in a hyperbaric chamber, what's happening with all this oxidative load is that, we get stem cells released. We're getting, as a result of these stem cells released, we're getting, these flood of new stem cells that we can heal different tissue, right? We're getting the immune system to activate. We're fighting infection. And that's really important. And this is a similar kind of example would be exercise, of course. Like exercise, you're shearing your blood, your arms or your legs or whatever to break apart those muscle tissue, and then you rebuild it and hypertrophy it as a result of that. So that's what the body does. The body responds to that oxidative stress. And so you want that capacity.
Right.
And so I always dance around this because antioxidants around hyperbaric therapy is a good question in the sense that I don't often like to give antioxidants when somebody's using hyperbaric therapy because we don't want to mitigate that hormetic response. But in some people, we need to give them because they're under such significant oxidative load already. And this is where something like methylene blue, for example, comes in, which is an energy enhancer and also as it works as an antioxidant as well. And so when I'm looking at somebody and working with them, I'm thinking, well, how can we optimize energy production? Of course, but how can we optimize their detoxification pathways and process at the same time so that they can benefit from the oxygen that's going in, creating that oxidative stress, increasing their energy capacity, and then all the fun things that happen with the epigenetic shifts that we discussed earlier. Then at the same time, how are they going to be able to detox from the energy that they make? So it really becomes like a full-scale operation. And that's, when you're thinking of things just in a silo, like one antioxidant, or without doing testing, for example. And that's a big part of what I do in my practice is looking at what's called metabolomic testing. And metabolomic testing is like the study of how your cells are working. Your vitamins, your minerals, your nutrients, everything in real time, what's happening in your cells. And so I can look at that and I go, okay, look, not a good time to go into hyperbaric therapy. Or if you really need to go in, we need to really think about how we're going to support you so you can benefit, but you don't feel like you can't move for 3 days after you get out of the chamber.
Right. No, it makes total sense. The analogy I use in my patients sometimes is, you have a fireplace and then you have a flue in the fireplace. And if you have, what hyperbaric therapy is basically doing is it's giving you a ton more wood that you're putting into the fireplace and you get all this energy being made. But if your flue is not functioning well, then you're just going to accumulate a lot of smoke in the room and it's going to be it's going to make you sick, right? And so you have to have that flue functioning really, really well of the fireplace so that you can actually get rid of the runoff of the reactive oxygen species that you're creating.
Right.
And I think people kind of understand that. So, a lot of times we do the same kind of testing as well to make sure the cellular function is good. And so people are ready for hyperbaric oxygen therapy. And a lot of times they're not. Like the people are not ready for hyperbaric oxygen therapy. They don't have enough antioxidant production that they really should, like you said, optimize their system first before they go in the chamber.
Yeah, it's unfortunately a diagnostic indicator if somebody goes into the chamber and feels like crap.
Yes.
Because if they do, there's more we need to do before you're really going to benefit from this, right?
Right.
Most people that will go in that are relatively well optimized will actually feel better in the chamber. They'll feel their more energy, they'll have more oxygenation, they'll feel a little bit brighter. They'll have several actually hours of where they feel like they can actually do more. interestingly, so when you're in the chamber, the oxygen stays in the circulation even when you get out for about 30 minutes or so. And so within that 30 minutes, you should be able to do more work, exercise, aerobic capacity, et cetera. But even oxygen utilization goes up and stays up for about 24 hours after being in the chamber. So if you're like an endurance athlete, you will see a benefit overall. But if you go too deep in the chamber and you're not well optimized, then you may not have that situation. And I've worked with tons of athletes over the years, and we found like the sweet spot is you really don't want to go, if they're like really hard training, if they're not recovering as well as they need to, if you go below about 1.7 atmospheres, they don't do well. Because it's too much oxidative stress for their system overall.
Got it.
Unless they're being well optimized by somebody like yourself or otherwise, and dialing in their antioxidants, dialing in their gut and all those kinds of things.
Right.
But in essence, you have to be really careful about oxidative stress and especially in elite athletes and people that are training all the time because they're just going to be more sensitive overall.
Yep.
And so it sort of correlates to people that are chronically sick as well.
Yes. So let's talk about that, a few of the indications of hyperbaric oxygen therapy. We alluded to some of them, and I'd love to know like how you kind of shift your thinking about the protocols in people that are using it for different indications. So, I think if you're using it for post-stroke recovery, if you're using it for a large wound, you definitely want to go to like a medical center that has someone like you on staff that can help you truly dial it in. But what if you're a person, let's go through a few different indications that we often see here. Sometimes a kid will be in a football game, high school kid, football game, had a concussion of the football game. How do you think about that patient?
Yeah, so again, the educationally throwing shit at the wall. So I'm saying it again. But in the sense of the hyperbaric piece, obviously the first step is to make sure that they're safe, that they've gotten checked out either by their team person or they've gone to the hospital, depending on the type of or how severe the concussion was. But then after that, the hyperbaric protocols can vary. The one that I like the most that's been pretty well studied is a gradation of pressure that starts off at 1.5 and then goes to 1.75, then goes to 2.0, all in the same treatment. So it's 20, 20, 10. So 20 minutes at 1.5, 20 minutes at 1.75, and 10 minutes at 2.0. This was actually developed by a lady outside of Chicago in North Dakota named Daphne Denham, and she had like 4 kids herself, and she was treating her kids and all their kids' friends and teammates on all their teams and that kind of thing. So, and she published a case report on it, which is pretty interesting. And so I use that if it's available. If it's not, you can still get benefit even from going to a soft-sided chamber, 1.3 or 1.5. And depending on the severity, sometimes twice a day to start off with, if they can. And thinking about their diet, of course, thinking about what else they're going to be doing. Certainly the recommendation of living in a dark room and not licking anything is not the way to go. And please don't do that, anybody. That's antiquated advice overall.
It actually creates the opposite response. It's actually worse for your brain to do that.
It's worse for your brain to do that. So, we're trying to make sure they're not eating crappy food, making sure that they're on the low carb keto side if possible, thinking about adding ketones as well. And also including that before hyperbaric therapy, because ketones are obviously fat byproduct of, and we use ketones for energy. And what can happen is that it's a more clean burning fuel, and it also protects the system from more oxidative stress. And so that could be really beneficial in somebody that just had a brain injury or a stroke or another kind of injury as well. So,
do you have a favorite pre-treatment ketone product that you like?
I use a number of them. I've used the Ketone Aid for a while. I've also used the Ketone IQ. I just got this new one called Ketonics that one of our colleagues was talking about in our longevity chat, which I've been trying myself, but I haven't tried it on any patients yet. So, do you have one?
I use Ketone IQ just because it's easy, just quick swig and it's done. But now we're in West Hollywood here, very close to Beverly Hills. There are 5,000 plastic surgeons here.
Is there 5,000 plastic surgeons?
I think it's close. I think it's one plastic surgeon for every 2 people that live here.
That's crazy.
So it's really nuts. But we have a lot of patients that come to us post-surgical. It doesn't have to be plastic surgery. It could be, a knee replacement. It could be lots of different surgeries. Post-surgically, how do you think about those types of protocols?
Yeah. So ideally, they get into the chamber before they get surgery, because it helps kind of prepare the tissue for the actual surgery itself. And so then 2 to 3 sessions before the actual surgery, and then maybe 3 to 5 sessions afterwards is kind of the usual, but sometimes depending on the surgery, it could be more than that. Ideally, again, it's deeper pressures. The deeper the pressure, in these cases, the more stem cells you release, the more inflammation that's going to go down. But you'll get benefit at 1.5, even so for sure. But the deeper the pressure, the better. At least to 2.4 is ideal. So I used to have when I had my clinic in San Francisco, we used to do 2.4, and I would see somebody's face go from looking one way to be looking significantly different, or you could see the swelling just go down very quickly after just one session. So then of course it's not just about going into the chamber; it's trying to also kind of impress upon them, dietary strategies. I use a ton of methylene blue in the pre-post-surgical perspective as well, because it also can work on hypoxic tissue. And help keep some of that more vital especially if it looks like it's not looking so good. Again, it's more looking at the holistic strategy if we can, but it's not as important if it's an acute issue like a plastic surgery. Hypothetically, they were healthy enough to get surgery, so hypothetically they're going to, that's not always the case, as you know, but people sometimes will do surgery on anybody. But hypothetically, just hyperbaric therapy on its own is going to be very powerful in that setting.
Yeah, for sure. And that's really great. And afterwards, you use it for like a week or two after the procedure?
Yeah, 3 to 5 sessions or up to 10 sessions. I mean, it depends on the person, depends on the surgery. The more intense the surgery, the more hyperbaric treatments they're probably going to benefit from. But sometimes it's hard for people to do that. So even if you can get 2 to 3 after a surgery, you're going to see significant benefit. From my perspective, what I've seen over the years, and it's pretty good in the quoted literature, it's a pretty wide range, 20 to 70% faster recovery if you're using hyperbaric therapy post-surgical.
Which is massive.
That's a big range too, but it's still massive. On average, it's about 50%. 50% faster. And so, of course, if you're an elite athlete and you need to get back on the field to make money, that's a big deal, right? But of course, if you got plastic surgery, you don't want to look like you have raccoon eyes for 3 weeks. You want to look at it like you had 2 weeks and that's also nice too, right? So
exactly.
I think it can benefit across the way. And it really comes down to the main thing that hyperbaric therapy is doing is it's healing wounds from the inside out, right? And it's doing all the things we described, reversing low oxygen states, decreasing inflammation, getting those stem cells to the area, preventing the tissue from scarring because it's getting more oxygen to that tissue, right? So,
and that's what I was going to say. What I found is it's not just faster healing, it's actually less chance of infection, less chance of losing some of the skin if the skin incisions happen to be really tightly put together. There's also, like you said, less swelling, which leads to better results because swelling can sometimes mess up the results of surgery, for lack of a better term. so
swelling's not what they want.
Exactly. You want to minimize the amount and the duration of swelling, and so hyperbaric is excellent for that. Just moving on to patients with infections. So we have patients that come to see us that have either, chronic mold exposure, they've had maybe Lyme disease. Sure. How do you think about those patients?
So in a very multifaceted way. Typically with Lyme and mold, they need to be working with a provider that's also addressing the Lyme and mold together.
Absolutely.
Hyperbaric therapy on its own is not going to go very well.
Absolutely.
It can help maybe in the short term, but long term, they all go back to the way they were before. This is my experience. It's unfortunate. And this is why I mentioned that 60 to 70% better before you come into a hyperbaric chamber, unless you're getting very directed mold therapy or directed Lyme, maybe earlier than that. But in general, I really try to wait until they're that better, because if you go too early, they'll get a lot of pain related to going to hyperbaric chamber, and they won't see a lot of the gain over the long term. Some people will, but in general, they tend to relapse over time. So I typically, if somebody's talking to me and they're saying, "Hey, doc, I have Lyme. I want to go into hyperbaric chamber," I'm like, "Who's your Lyme literate physician?" Or who are you working with that's working on the Lyme aspect of things? And then, because especially as we start, killing organisms, because hyperbaric therapy, that's what we do. How is that all going to work? Do you have the detox processes that are going to be able to be? Are they high enough? Are they revved up enough to be able to work with that? So I think about it in a multifaceted way.
And usually these patients are not. Usually their detox pathways are very slow and injured, and so they need to really get treated for that first, right?
Yeah, and the nurse that I learned from was actually a Lyme patient.
Oh, really?
She was the head nurse at the facility that I was a medical director in 2013 when I first started, and I saw her own experience. I saw her go into the chamber and get better. But then she would get worse again. I saw her get in the chamber and get worse again. And then she would tell me stories about the first time she went to the chamber where she'd have to be wheeled in a wheelchair. Like she couldn't even do it. And then she kept having all these relapses until she really started working with a provider that was really focused on the Lyme literate side of things and really working on her detox pathways and all the other aspects of Lyme treatment. And that's when I saw her really get better over time. And then that really affected me significantly, because I saw that not only with Lyme, so with mold, with any chronic infection.
You saw it firsthand.
And I saw it with chronic inflammatory disorders, autoimmune issues, all the same thing. Like if you went into the chamber, you didn't do all the other stuff beforehand, you just were not going to see the benefit that you wanted to see. And so that's where I get in trouble, right? Because I don't always say, hyperbaric therapy, go ahead, here's your protocol. No, let's wait 3 to 6 months, find a doctor that can help you. Maybe I am that person, maybe I am not that person, depending on the situation. And I'm happy to refer. I always I always refer. I'm happy to do it. Yeah,
for sure.
Yeah.
And then maybe the last category of person that we'll talk about, we touched on this a little bit already, is the longevity enthusiast, the person seeking to maximize their health span and lifespan. And these are people that want to come in, they want some sort of routine. I feel that it's hard for them to come on a daily basis because this is something they want to do for a long term.
Of course.
So what is the most manageable protocol for someone that's looking to optimize their longevity?
Yeah, I mean, I think the first thing to say is that you should not be going to a hyperbaric chamber every day.
Right.
And I think that's another problem is that if you buy a chamber at the house or from another company, whether it's a hard chamber or a soft chamber, you don't know. And then I've had people say, oh, yeah, I'll use it for 6 months every day. I'm like, oh, no, please no. No matter what type of chamber, that's not a good idea.
Yeah.
And so the key to understand is that the way I think about sort of longevity and long-term use of hyperbaric therapy is that you're using it in protocols when you're going in 5 days a week for periods of time.
Sure.
Those periods of time get shorter as you've had the chamber for longer. Right. And then, but in between those periods, which may be every 6 months to a year, you're going in what I call in kind of a maintenance type of mode, where you're going in maybe 2 to 3 times a week and you're varying your pressure. Typically, you're not going to super deep pressures all the time because that's not really what the body needs all the time. And varying that pressure is like varying your exercise. So you want to go to like milder pressures, like 1.3 to 1.5, maybe 1.7, but like you want to vary it around, right?
Sure.
And the key for me is that if you're doing a long-term hyperbaric therapy, you can see massive benefit, but you also have to be looking at your biomarkers over time too.
Yes.
Because you don't want to deplete all your antioxidants like we talked about earlier. You don't want to deplete your capacity, like your GI system, and like you're all of a sudden having issues there, right? Like especially if you're using deeper pressure for longer, deeper pressure hyperbaric therapy is going to kill anaerobic bugs. And that's good if you
It affects your microbiome.
It can, yeah. We don't have a lot of data here, but in experience, we know that it directs it against anaerobic bugs.
Right.
These are the ones that cause issues in a lot of different conditions, like inflammatory bowel disease, for example, right? So Crohn's and ulcerative colitis. But so you have my concerns, and I work with people long term. They have their chambers at their house. I'm always looking at, look, if you're going to have a chamber like this, I don't care if it's a soft chamber or a hard chamber, but especially a hard chamber, you really got to be making a really good effort to follow your oxidative stress markers on a regular basis, your mitochondrial function on a regular basis, and then that's how you can maintain, that you can really have a benefit without having any detrimental effect. And again, I use a lot of different tools and technologies aside from hyperbaric therapy, but long-term, it's either you're on a protocol 5 days a week or you're on maintenance.
Right.
But the protocols initially can be long, like maybe 20, 30, 40 sessions, but then over time, that might be 10 or 20, like 6 months or a year later. So it depends on the person overall. But
And so for the people that have a hard chamber at home, for example, or a soft chamber, what are you recommending? Like once every 3 or 4 days, once every week, or is it every other day?
It just depends on what's going on, right?
Yeah.
So what I typically...
For longevity, for example.
Yeah, I mean, for like a longevity, it's, it's one of those things where, what does that mean exactly, right?
Yeah,
but for me, I would have them be doing a protocol where they went for their 40 sessions, typically at a deeper pressure if they could, maybe once every 3 to 5 years, depending on the situation, maybe less or maybe more frequent than that. But in between that, going in from like day-to-day operations, I like people to target their sessions to what they need. Like, is it targeting like for exercise recovery? Right. Is it targeting because you just got off an airplane? So then maybe you want to do a couple sessions in a row, right? You're targeting because you just got an injury. Right. Or you're targeting because you need to go in there with your daughter who just had a concussion. That happens to me, right? Sometimes, right? I bring my kids into my chamber at the house. But so I like to think about it as maybe more on the Healthspan side, because it's more like, how are you optimizing your health today or tomorrow? Right. I didn't really kind of figure that out until just you asked me that question. It's a good one, because like, it's not like I think there's longevity potential.
That's what I meant. Yeah, more Healthspan.
But I think it's more like, how can you help on your day-to-day operations health? And that's what the like 2 to 3 times a week targeted to those Healthspan metrics would be about, I think.
Exactly. And I think it's also key for people that have their own home chambers is not to spend the night in the chamber.
No, please don't do that. Yeah, no.
It's 45 to 90 minutes at the most, but every few days and that's what I was kind of getting at is, we have a lot of people that, once again, we're in Los Angeles. People are buying chambers for their home. A lot of people have their own biohacking facility in their home. And they really don't know how to manage it. They bought everything, but they have no idea how to use any of it. And people are trying to do everything in their home every day. Their LED light, their hyperbaric chamber, their cold plunge, and it's like way too much.
And this is actually why we created the education app that we've been working on. My company is called One Base Health, and that company... That's exactly the reason, because people are getting all this stuff at their house and they have no idea how to use it. And so the idea is like, well, let's show you how. What are your goals? When do you not want to use these things? What are your wearable technologies showing you? And how is that all integrating together? And then how can you build your own protocols with your practitioners as well and kind of push that to the app as well? So
what's the name of your app?
It's called One Base Health.
One Base Health. I haven't seen this yet. I'm excited to check it out.
Yeah,
okay, great.
Yeah, so it's just coming out with some features now.
Okay.
And the idea really is how you can integrate all these kinds of technologies together.
I love this. So, at Next Health, we have all these technologies, and it'd be fantastic if we could work together with our patients to use your app. This is fantastic.
Yeah, right now they're all going to be built with our tech, so our chambers and things. But over time, there'll be more of a democratizing of that, I hope. That's my goal, at least, over time. But yeah.
Can I ask you a little bit about, you mentioned some biomarkers of oxidative stress, biomarkers, what are mitochondrial health? And these are, biomarkers that most people don't normally get at the regular doctor's office visit. So can you talk about what are the biomarkers and how often are you checking these?
Yeah, so there's different perspectives here.
Yep.
I know that I'm interested in yours, actually, what your perspective is as well. What I typically use is they're more advanced, but they're relatively basic because I think some of the advanced testing, I'm not convinced really has a direct manifestation or a direct correlation yet. So I use typically organic acid testing. Pretty simple. It's just a way to look at how those inputs are going in to your energy cycles and how you're doing on the detox pathways, right? So you can look at the intermediates in your citric acid cycle, which is part of your mitochondria that helps us make energy from our food. And you can look at all of those, and you can look at signs of oxidative stress on the mitochondria itself, looking at various markers like lipid peroxidase and 8-hydroxydeoxyguanine, looking at glutathione levels and CoQ10. I keep it relatively simple. You can look. I look at toxin detoxification markers on the organic acid panel, but those are the ones I typically will look at. And depending on and sometimes blood markers too. Some things like your CRP, your ESR, your fibrinogen, your ferritin levels, and others that I'll use as well.
Right. Yeah, that's kind of what I recommend people do is organic acid testing.
Yeah.
There's some newer screens out there that, like you said, I'm not super convinced yet that they work or they're even being done in CLIA certified labs and things like that. So I'm a little bit careful to have people waste their money on those. But I think organic acid testing has been pretty well documented and been used for a while now in these types of situations.
Yeah, and that's one of the things that we teach actually at Health Optimization Medicine and Practice is to how to interpret organic acid testing, metabolomic testing, which is metabolomic is the real-time cellular processes, what's happening right now, what just happened. And that's what organic acid testing is really able to help you do. But we're focused on optimizing for the health of the system, not looking at disease markers or looking at it for disease state per se.
Right.
Now, it's a little bit of a different shift in perspective, but in essence, organic acid markers are fantastic because they give you a real sense of what's going on foundationally. So we teach how to interpret those markers. We teach you how to interpret them in the context of health, in the context of diet, lifestyle, supplementation. It's the foundational module of the certification. And then there's 6 other modules, things like epigenetics and exposomics and gut health and bioenergetics. And exposomics is the study of toxins in the environment, by the way.
Sure.
And so, and a couple others as well, but chronobiology and things. But the key really for my clinical practice is that's what I'm focused on.
Yeah.
I'm focused on really optimizing that foundation. And then once that foundation is built, then it's much easier to do any other tool or technology that you wish to do, including hyperbaric therapy. But, as you know, as well, Darshan, like so many people are just having such a hard time with mitochondrial function, right? 94% of the US population at this point has some element of mitochondrial dysfunction. And it's really difficult, right? And there's been a lot of interest in methylene blue recently. I know you and I have been chatting about this, and I brought you some products as well.
Thank you so much for these,
Yeah, no problem. So I really got interested in methylene blue specifically, and that's our product called Just Blue.
Yes.
When we realized that it had this amazing capacity to really support mitochondrial function, right? It really helped with not only the capacity to make energy, but also the capacity to detox at the same time. There's very few things out there that do both. There's very few that will enhance energy production and also increase your capacity to have an additional antioxidant response.
Yeah.
It can work directly as an antioxidant. At low doses, it does that. At high doses, it actually can induce the production of your own antioxidant supply as well.
Interesting.
Yeah. But the key with methylene blue that I found so fascinating is that it could compensate for any complex disorder in your electron transport chain. So you have these 4 complexes in your electron transport chain in your mitochondria that help you make energy. What methylene blue can do is that if any of those are disrupted, and many of them can be, it can compensate for that disruption. It can bypass it. It can recycle things like NAD. If NAD is not being used appropriately because complex 1 is not working very well. And so it has this capacity to go in there at these low doses and see remarkable changes in not only in helping compensate for it, but then eventually helping with the reversal of some of those issues as well with long-term use, along, of course, with doing the other stuff, doing the optimizing lifestyle and diet supplementation. So but it gives you and buys you time.
Yes.
And that's the hardest thing, I think, and you're in practice too, is like if people are so sick or they're just having such a hard time, even starting B vitamins can be difficult for some people. Like it's just, the system can't tolerate it, right? But I found that like very low doses of methylene blue, you can start them at very low dose, 4, 8, 16 milligrams, and you can slowly titrate up their dose and they start feeling better. And then all of a sudden they can start doing the other things that you were hoping that they could do initially. They're more motivated because they have more energy.
Yeah, absolutely.
Their brain's starting working. I have a quiz question for you. Do you know where we have the most mitochondria per cell, Darshan?
I would say it's your type 2 muscle fibers.
So if you were talking to Gabrielle Lyons, that's what she would say. But you have the most reserve in your muscle, but actually the most working at any one time is your ovaries or your sperm.
Oh, that makes sense
right?
actually.
Making a baby is a lot of energy, right?
Right.
So you have your most mitochondria per cell in ovaries and sperm, and then second is your brain, then your heart, your liver, and your musculoskeletal tissue, right? So you have the most reserve.
Got it.
Awaiting the need in your musculoskeletal tissue, in case you need to run from a lion or something like that, right? But in essence, why are we seeing such issues with infertility, right? Because of mitochondrial dysfunction. Brain issues, brain fog, concentration, fatigue, it's all related to mitochondrial dysfunction.
Right.
So top causes, you know this, but toxins in our environment, medications can do it. The most common medication actually that causes mitochondrial issues is metformin, and PPIs are a big one too. Then you have infections that can do it. So COVID infection absolutely did it. But long COVID infection absolutely causing mitochondrial dysfunction. Then the top one is actually insulin resistance. So if people are insulin resistant, like they're not utilizing sugar well, their mitochondria are not going to be happy. No. And so as a result of that, they got more flu, more smoke, as you said. I liked your analogy. And as a result, it's not going where it needs to go. And you get more sludge in the system. So what can we do? Like there's many things that we need to do, but sometimes just taking something is what all our patients can do initially. And methylene blue is a great way to start off with people.
Methylene blue is such an incredible compound because, I think my experience with methylene blue has been in surgery where we use methylene blue as a dye marker.
As a marker,
right? And then also we use it as a marker for also tracing lymphatics because it'll kind of travel along the lymphatics. So then when I heard about people using it for, IV or orally, I was like, wait, what are they doing? And you often see people with like, their mouth is blue, biohackers. I was wondering like, what is that all about? Like, I thought this was just a dye.
I know,
and it's really interesting to me just at a bioenergetics level, how something that manipulates light can actually affect your electron transport chain in your mitochondria. So do you have any idea what the actual mechanism is there?
Yeah, we do. So the history of it is pretty interesting overall, right? So it was the first drug that was registered with the FDA.
Right, the first drug ever.
First drug ever in 1897. And it was for malaria. And it got the name at that time of a magic bullet. And it got the name magic bullet because you could give very high doses of methylene blue. It would kill pathogens, but it would not harm normal human cells. And so that's what they were looking for at the time. There was no chemotherapy. There was no drugs for anything like that. So methylene blue would work against infection. And you could use it very high doses. And they were using huge doses actually for malaria. And it was like one of the first and the only antimicrobials available until the 1950s. And so it was used for urinary tract infections, for fungal infections. If you grew up in a developing country, you would get it as a lollipop for viral infections. Like you'd paint your mouth blue and everything like that because it's a fantastic antiviral as well. And it works at these higher doses, like above about a milligram per kilogram. So that's about 70 milligrams or above. It works as a increaser of something called hydrogen peroxide in the system. So what happens is that methylene blue comes in, it competes with oxygen to bind in the electron transport chain, and it can actually make hydrogen peroxide instead. And then that hydrogen peroxide is a anti-infective. And so, and hydrogen peroxide is how our body actually takes care of infection. And what's cool about that is that there's no resistance patterns that have ever been shown against methylene blue to infection because it creates hydrogen peroxide as its main mechanism. And so until the 1950s, it was the only thing around. But in the 1950s, penicillin, the magic drug, and of course, we know from there, antibiotics, antimicrobials of all different types. So methylene blue became less used as a result of that. It also had these side effects. These were minor side effects, but they were visual side effects. Blue urine, blue secretions otherwise. At very, very high doses, over 3 milligrams per kilogram, it actually can cause other secretions to be blue as well. And so it got its new sort of... from the 1950s, it became, so the first antipsychotics were actually derived from methylene blue.
Really?
Because methylene blue is also a monoamine oxidase inhibitor. So it increases norepinephrine, serotonin, and dopamine. So it increases the mood, improves mood, and actually has been shown in various studies to be pretty good for depression and bipolar as well. And so there are people that are weaning their patients off of things like SSRIs and using methylene blue instead. Under clinical supervision, of course, because we know that depression is not a serotonin deficiency. Right? We know that depression is for a lot of different reasons, but it's not a serotonin deficiency. So not that SSRIs can't be helpful in some people, but in essence, methylene blue has that component. But the cool thing about it was that, I don't know if you did this when I was in college, I used methylene blue to stain our cells. And methylene blue is used in chemistry. And what methylene blue does in chemistry class is actually concentrate or stain into or concentrate in your mitochondria itself.
That's how you found the mitochondria when you're looking under a microscope.
Exactly, exactly. And so the mechanism there is that methylene blue is a redox cycler. Basically, it can donate or pick up electrons because of just how it's created. And so that if there is a need for it to donate electrons, it will do that. That's the electron transport chain. But if there's a need to pick up free electrons, which is your oxidative stress, it can do that as well. So it's this really cool capacity for it to do both. So it can stay in the system and recycle itself. Cycle on, cycle off, like on and off, on and off. And so when it's in the oxidized form, which is when it's donating electrons, it's blue. But if it's in its reduced form, which means it's picked up free electrons, it's actually colorless. So,
interesting.
It's called leucomethylene blue.
Got it. And where does it come from? Where is it made from?
It's a synthetic. So it was made as a textile dye in the 1870s, and it was dyeing blue jeans blue. The first thing that dyed blue jeans blue was actually methylene blue.
That's so interesting.
Yeah, I don't know how they got from dyeing blue jeans to treating malaria, but I kind of know. Like they were looking at this class of dyes that methylene blue is part of, and looking at what would kill malaria because they didn't have anything else that would really work against it. So that's really how it kind of came to pass that it got to be more of a medical therapy. But it really kind of fell by the wayside because, again, there was cooler, fancier drugs. And then now we know that it concentrates in the mitochondria. There's been a lot of interest, at least in the research side, using methylene blue to improve mitochondrial function. Of course, it's a drug that's way off patent. So nobody's going to be
making money off. No one's doing studies on it, right?
There's been a couple different drug companies that have looked to find derivatives of it and then use that derivative in pharmaceutical. And there's a couple urinary tract infection over the counter that you can get methylene blue in them with there. So, I'm using a lot of methylene blue for urinary tract infections, both as prophylaxis and as treatment as well. But so the lower doses, 4, 8, 16, 25 milligrams, these are really nice doses for mitochondrial optimization. They can support mitochondrial function. You titrate the dose until it starts working well. The higher doses, over 1 milligram per kilogram, 70 milligrams or higher, that's more for acute infection, acute stress. Like I have all my patients with methylene blue in their medicine cabinets at higher doses in case they get acute infection or they get acute trauma or, God forbid, a stroke or a heart attack. Still go to the hospital, of course, but take your methylene blue as well at, about 2 milligrams per kilogram for something like that.
What about post-surgical? Yeah,
post-surgical, same thing. Usually there's a huge amount of stress on the system, huge amount of inflammation. What's cool about methylene blue is not only can it compensate for any aspect of the electron transport chain not working very well, it can also act just like oxygen. So it can be the final electron acceptor, just like oxygen would be. So it works to increase your aerobic capacity. And they've done studies on stroke and traumatic brain injury, at least in animals, that have shown that they have more tissue that survives if you give them a high dose of methylene blue when they have the injury. So, so I don't think most people need high doses. And in fact, I think that's been a big challenge over the last several years is that that Just Blue, that's 16 milligrams,
16 milligrams, got it. And so this is a troche, it means you put under your tongue, a troche, you put in your tongue, under your tongue, and you
So the way we developed them at Transcriptions, it's the name of the company. So short story is that Health Optimization Medicine we've been talking about is a nonprofit. We created a for-profit entity called Transcriptions in 2020 so that we can help people right now while they're on the longer path of health optimization, which, as you know, can take a while for some people. And the first products we came out with were the ones that were based on methylene blue.
Got it.
because methylene blue, as we described, is a fantastic mitochondrial optimizer. And the dosing that we chose was much lower than what was thought to be the therapeutic dose. But there were some studies, especially, there's a really interesting study in Alzheimer's disease. They gave 3 doses of methylene blue. One was 8 milligrams twice a day, 75 milligrams twice a day, and 150 milligrams twice a day. And the 8 milligrams was your sham control because everybody needed to have blue urine.
Yes.
If you have 16 milligrams of methylene blue, you're going to have blue urine.
Right.
The 8 milligrams twice a day, the sham, did much better than the 75 or 150.
Really?
And
interesting.
the reason for that is that these higher doses of methylene blue, they do cause stress on the system.
Got it.
They increase the amount of hydrogen peroxide produced, which is great as an anti-infective. But it also induces what's called your NRF2 pathway, which hypothetically is going to make you produce more glutathione.
Right.
If you can't do that because your brain's already under duress because you have Alzheimer's or mild cognitive impairment, that's going to be a problem.
Right.
So one-time doses of these higher doses can be okay, but like longer-term dosing at those kind of high doses can be detrimental, is what I found, especially for more of a chronic presentation like that.
Makes sense.
Yeah. But if you're going to be on higher doses for long periods of time, and some people do need these, like if you have Lyme, if you have especially Bartonella, which has been shown to have what methylene blue does at these higher doses actually breaks up biofilms. So it breaks up the biofilms that protect the organism from being treated with other types of things. And so it actually can break up the biofilm in your GI system. It can break up the biofilm in your urinary tract. And so we have a number of clinicians that are using it for a severe condition called interstitial cystitis.
Sure.
And using methylene blue at these higher doses, seeing massive benefit. At the lower doses, we're seeing it as a prophylactic, right? As something that could potentially prevent infection, especially like women, menopausal, chronic urinary tract infections. Using it regularly, at least anecdotally, we're seeing really benefit there. There hasn't been any studies on it, but I mean, at this point, we're using our clinical judgment as we always have to in the world of what we do. But the troche, just to mention that, so it's a dissolvable lozenge that can be dissolved between your upper cheek and gum. At Transcriptions, we developed the troche because it's a fantastic delivery device up here. It works fast, and it bypasses first-pass metabolism in the liver. Liver digests things, degrades things, detoxifies things, of course. However, with methylene blue, pure methylene blue, it's almost 100% bioavailable, whether you get it in the IV, obviously, or even as a troche, or if you swallow it. So what's different about it, an oral version of it dissolving in here, is how fast it's going to get into the system. And in a lot of my patients with chronic brain issues, concentration, fatigue, attention issues, they do better if they dissolve in the mouth. However, that will mean that they will have a blue mouth. And so the better way to do it for most people is to have it on an empty stomach and then eat about 15 to 20 minutes later in general. And that's really a really nice way to take your methylene blue.
So just swallow one of these and just and eat later, right? Exactly.
And the other thing about the troches is that they're scored. And so they have you can take a quarter, you can take a half, you can take a full. And so that's really a nice way for people to be able to titrate their dose over time.
Got it.
The titration is key. And you know this as well, right? At least in my clinical practice, is you don't always want to start off with the dose. Right? You want to start off with, and this is with hyperbaric therapy too. We didn't talk about it, but oftentimes with hyperbarics, you don't start off at 2.4. You go 1.5, you go to 1.75, and you kind of you get them through. And that's what we do with the troche. It's easy to kind of take a quarter or half or full. And so a lot of my patients, they're taking a quarter or half, many times a week, especially when they're doing hyperbaric programs, if they're mitochondrial, a lot of stress, and then we're titrating their dose to see what they need. But it's a really fantastic tool.
That's amazing. And so with hyperbaric therapy, like you're saying, for most people, you don't want to have any antioxidants for maybe a day or two, let your body kind of develop the balance. Is that right?
Yeah, I usually, it depends on the situation, like 3 to 5 hours at least.
3 to 5 hours.
Yeah, I mean, I think it depends on the person and kind of what they're going for. But in general, 3 to 5 hours is what my goal for most people.
So if you're using methylene blue while you're on a hyperbaric protocol, how do you time it?
So it depends on the person. It depends on what they're using hyperbaric therapy for. If they're super sick and we need to get them in the chamber, and I usually would give it before as a way to support their energy production system and as a way to help their detoxification system.
Right.
If they're relatively well optimized, then I usually give it about 3 to 5 hours afterwards, because that's going to help with their detoxification pathway and help them kind of clean things up. So it really just depends. But, oftentimes it's usually very low doses before is when I'm using it because I'm trying to help support their antioxidant system, while they're going through.
That's great information to know. Yeah,
Yeah.
absolutely. So I want to touch on one more thing in the few minutes that we have. You're another one of your expertise is GABA.
Yeah.
And you also brought another product that you work on in this realm, right?
Yeah.
Can you tell me what this is?
That's called Trocom.
Yeah. Tell me a little bit more about. Is this a troche also?
Yeah, there's troches as well.
Great.
There's a troches. That's a sample pack. But the kind of the big picture here, of course, right? So the nonprofit optimizing health, right? When you're optimizing health, a lot of roadblocks, a lot of bottlenecks. Energy is a huge one, right? But stress and anxiety is gigantic, right? So many of us these days are just on all the time. Have a really hard time shutting down and shutting off. And the system that's responsible for helping you shut off is the GABA system. So GABA is a neurotransmitter, GABA aminobutyric acid. It is our most prevalent. It's our largest, it's the one that causes the most inhibition of any other neurotransmitter. It's about 20% of the brain's neurotransmission is GABA. And GABA is always in a fine balance with something called glutamate. Glutamate is our primary excitatory neurotransmitter, and GABA is our primary inhibitory or relaxation. Think of GABA as like your on and your GABA is your off.
Right.
It's like the brakes of your brain. And what's interesting about that is that GABA actually gets converted in the brain from glutamate. So glutamate is it starts off as glutamate and it gets converted into GABA in the brain. And so it's very difficult to actually, you don't get GABA directly in the brain. You actually get converted from the glutamate, and at least not very much. And so you always have this balance, right? So the common example, is you go to a Chinese restaurant.
Sure.
With MSG in the food, monosodium glutamate.
Right.
So all of a sudden you get this huge amount of glutamate in the brain and you get headaches, you feel irritable, you don't sleep very well because some people can't convert very fast over from that MSG, from the glutamate to GABA. You need some cofactors, like you need B6 and magnesium specifically to be able to do that. And so if you're deficient in those, for example, you're not going to have that good conversion. And the other challenge is that people are GABA deficient these days because they're hyper stressed all the time. That's going to deplete GABA. They're toxic. They have leaky guts, and they don't have enough substrate, which means that like our main fuel that actually makes glutamate is something called glutamine, is an amino acid that also fuels our gut. And actually, it's the primary fuel for our small intestine. So if you have a leaky gut, all your glutamine's being used to try to heal that up, and it's not getting to enough glutamate, and you're not getting enough GABA. And so you can have vitamin, mineral, nutrient deficiencies that cause GABA deficiency. And then clinically, what do we see? We see people with anxiety, with insomnia and depression. And GABA is really cool because it's called an interneuron. So it's basically like a waylay station between your superstar neurotransmitters like your serotonin, your dopamine, norepinephrine. So it regulates the flow between all of that. So if GABA is not working well, you're not regulating flow well. And so it's interesting. Like another good fun fact is that we have about 70,000 thoughts per day.
70,000.
70,000, yes. If you're anxious or you're depressed, it goes up to 120,000 on average.
Wow.
And so GABA is what's required to calm down that firing of your brain. So you can calm down all those thoughts back to your baseline of 70,000 thoughts per day. Don't believe everything you think, right? It's a lot of thoughts. And so what we did, and looking at it, is that there are people, and there's a lot of supplements out there that give you GABA, right?
Yeah.
The problem is, though, that GABA is too big of a molecule to get across the blood-brain barrier. So if you take GABA supplements and they work for you, it usually means that your blood-brain barrier is not doing what it's supposed to do. Otherwise known as
having... Or it's a placebo effect.
Or a placebo effect, for sure. That's a good point. Or otherwise, I would say if the blood-brain barrier is not working very well, we call that a leaky brain.
Leaky brain, for sure. Right?
And that's a scary term for people, but usually that just means that you have to do some work on the gut itself. Leaky gut is associated. So what we did at Transcriptions at the company was we created these compounds, one called Trocom, one called Troz for sleep, that comprehensively enhance the GABA system in a holistic way. So GABA, when it binds to the receptor, there's a site where GABA binds, and then there's also these other sites where other things can bind. Alcohol binds there, benzos bind there, barbiturates bind there, and they massively increase the affinity for GABA to bind. But also, and that cause tolerance, withdrawal, and dependence because of that. There's also kava, CBD, CBG, hanakyle from magnolia bark. These bind to these other sites and enhance the affinity for GABA to bind. But the problem with just using those on their own is that they will decrease GABA over time too. So we combine what's called an allosteric, or like a separate binding to the GABA site, along with something that binds to the GABA site where GABA would bind directly as well. And that's called an orthosteric ligand, is the fancy term. So that could be GABA. So in our Trocom, we have nicotinyl GABA, which is vitamin B3 attached to a GABA. And when it's attached, it can get across very easily across the blood-brain barrier because B3 does have a transporter.
Sure.
So B3 kind of like takes GABA along for a ride.
Right.
And then they break apart, and you have B3 and GABA in the brain. GABA binds to where it would bind.
Right.
And then you have CBD, CBG, and kava in that formula. Mm-hmm. They're all binding to separate sites on the GABA molecule, enhancing the affinity for GABA to bind.
Got it.
So what's cool about that B3 in there too is that it's mildly activating. Yeah. So Trocom is great because you don't feel tired, you just feel more relaxed. But it's strange for patients because they're used to taking benzos and feeling dead, right?
Yeah.
And so that's a little bit of an educational thing. But then we have our Tro-Z, which is our sleep formula.
Sure.
And that has hanakyle in it, which binds to a separate site on the GABA receptor. And something called agarine. Agarine is from a psychedelic mushroom called the Amanita muscaria mushroom.
Okay.
It's the one that has, it's a red cap with white dots.
Yes.
Santa Claus mushroom, Alice in Wonderland, Mario Brothers.
Yeah, I've seen that mushroom. Where can people find you and hear more about you and some of your teachings?
Yeah, so many places, right? So my hyperbaric consulting, I do that at integrativehbot.com. Okay. My hyperbaric company is called onebasehealth.com, and that's integrative app that's coming out so you can figure out how to use all your technologies at the house and all going to be tied to a Bluetooth activation from one app, which is going to be fun. And then I have my own personal work, like on Instagram at Dr. Scott Scherr, DrScottSherr. So you can follow me there for tips and tricks. And then Troscriptions is the product development company with Methylene Blue, the Just Blue that you have over there, and Trocom, that's at Troscriptions and Troscriptions.com. And then finally, if you're a practitioner, I already mentioned, homehope.org is where we have our training.
Right. Thank you so much for joining me today. I really appreciate you being here and can't wait to have you on again one of these days. We're going to talk about more stuff. Thank you so much.
Enjoy the rest of your day.
Thank you.